going to learn about different parts of a vertebra. And then second, we're going to learn about different kinds of vertebrae. Learn to identify different major groups of vertebrae. And that's our two major goals with vertebrae. So thinking about different structures that you have to know on a specific vertebra. Pick up something here that, in case I need this to kind of point out some items. We're going to learn some different parts of a vertebra. And our first part is going to be what's called a vertebral foramen. We can also call that intravertebral. Not inter, but intravertebral. So it could be called vertebral foramen, vertebral canal, neural canal, intravertebral foramen, lots of different names for the same thing. That is the big opening. You can see the big opening in a vertebra. Maybe you can see it up against my dark shirt a little bit easier. That's that large opening. What goes through that opening? That's the spinal cord. So what goes through here is a part of the nervous system called the spinal cord. Now, I'm going to draw some vertebrae up on the board, and I'm going to draw two of them like they would be in life, looking from the side of a human. So you're looking at maybe the left side of a human. We're going to draw two of them. The reason why I'm drawing them, because then you can duplicate these simple drawings as well as part of your study. It's way more interactive than just looking at pictures while I point out things. So we're going to try to draw two vertebrae if I can. And you're going to find out quickly that I'm not a terribly good artist, which means that if I try to draw something, you can too. Boy, that did look hideous. Usually I draw these on animals because I teach animal courses. It's much easier to draw them from the side, like for an animal it is for human. Okay, two vertebrae from the side. We're looking at a couple vertebrae from the side in this particular perspective. Looks like I need some more chalk. Don't I? Need this thing and need this one. We're looking at two of them. Here is the spinal cord going through our vertebral canal, vertebral foramen. Okay, there's our spinal cord, just to get ourselves oriented. And now we can start identifying some other features on this. This part here is what's called the body, or you may have learned that in another course as centrum. And that's this big bony disc-like portion. It's the big heavy disc-like portion. That's called the body or the centrum. Between the successive bodies, there is a fibrocartilage structure. So I'm drawing it blue because we've often shown cartilage as blue. This is a fibrocartilage structure called an intervertebral disc. Disc with either a C or a K, either one's fine. That's that fibrocartilage structure between successive vertebrae. On our whole skeleton here, we can see it as this sort of clear yellow area. That's what shows, or the clearish areas where it shows cartilage at. It's a fibrocartilage structure. Pretty tough bit of cartilage right there. It's got to support a lot of weight, so it's a little more structurally stable than its hyaline cartilage. There's a couple of projecting points. The one that points posteriorly or dorsally is called the spinous process. Let's see if I've got a vertebra that's a bit longer one so we can see it here. A little bit more obvious. Okay, so we've got spinous process, this long pointed projecting point right here. There's also some points that project out to the sides. And that's a little bit hard for me to show here in 3 dimensions by drawing the chalkboard. Very quickly you're going to see my limitation of drawing. These are supposed to be laterally projecting processes right here. And so we're going to call these, they are in the transverse plane, we're going to call each of these a transverse process. Both of these serve as places where muscles attach, muscles that primarily move the trunk, bend the trunk to the side or forward or backwards. And a lot of times when a person gets a back pain, back injury, it's associated with strains in those muscles or where they attach onto to those particular bony projections. There are other things that can cause back pain as well, as we're going to see here in a little bit. We also see these projecting points in the superior and inferior direction that allow the vertebrae to connect with one another. The one that points in the superior direction, we're going to call a superior articular process. Superior because it points in the superior direction, and articular because it articulates. Articulation refers to a bone-to-bone connection. And then our bottom one is going to be inferior articular process.
And what's the purpose of those?
Those allow connection from one vertebra to another. And in particular, they serve very well as anti-twist devices. So if we look at these look like some lower lumbar vertebra, maybe about L1 or L2 and 3. So these are kind of connected. They were going to be sitting just like this in a person right here. And they got a little sponge attached to them with intervertebral disc, which kind of shows the movement. And what we see is that this allows movement kind of in this direction. That is kind of a flexion extension. There's a little bit of movement side to side as well. Okay, side to side. What it doesn't allow very much is twisting. Those articular processes, we can see where they connect together. If I try to twist, they allow very little movement. In fact, you've got almost no twisting possible on your trunk. It looks like I'm twisting here. Essentially, all I'm moving is my shoulders. There's almost very little twisting can be done on the vertebral column. Twisting, that ringing, is very bad for a spinal cord, and those devices really tend to prevent that. So those are connecting devices. Last structure on the list of things you know specific to, another piece of chalk yet, of parts of a vertebra, there's something called an intervertebral foramen. There's more or less an opening right in here. That is called an inter, not to be confused with intra. That's a little opening you see on the side between two successive vertebrae. It requires two vertebrae to make this opening. And that's why we use the inter as part of the name. Inter refers to something that involves two or more things. If you have an interstate highway, say like I-64, it's going between more than one state. And in fact, the name doesn't change. If you take I-64 going east into West Virginia, it's still I-64 when you get into West Virginia. Interstate highway. In contrast, intrastate highways, that literally is state highways. If you go from one state to another, as soon as you cross the border, the number changes. You can be on the same road, but now it's a new road, it's a new highway, because officially that highway ends at the state border and you pick up a new one. But inter involves more than one thing. In this case, it takes two vertebrae to make that. Why do we have an intervertebral foramen? We take a look at this picture here, and what we see here, here's an intervertebral foramen, this gap right here, or this gap right here. What's going through that? Spinal nerve. Okay. So the important function of that intervertebral foramen allows passage of spinal nerves. That way you can get spinal nerves get in and out of that neural canal, out of that vertebral canal, vertebral foramina that's formed there. And these are all the different structures that you have to know from this figure. And certainly use this. This is obviously much better art than what I can draw on the chalkboard. But I gave you the chalk drawing on the board because now you can do that as part of your practice to help learn those different names. By the way, you will not have a word bank on the quizzes on Wednesday or Friday. You will not have a word bank on the exam on Monday. So I strongly, strongly recommend as part of your study that you use writing. actually start writing out the words. Make diagrams and write out the words. Oh, okay, the other one, good question, yeah. It is room 330. I said 325 originally, it's 330. It's still the one across in the bathroom, I just had the number mixed up. That room should be open all this afternoon. I'll try to remember, if it's not open now, I'll open it right after this class. Also, if you want to use whole skeletons to study, there are almost every classroom on this floor has a plastic skeleton that's available as well. This room has no class. I teach in here at 12:40 to 1:40, and after that there's no more classes the rest of the day on Monday, Wednesday, Fridays. So I know it's open the whole afternoon. Or you can look on, there's actually a schedule on the outside of the door now, I think, and you can see when it's open or available. And you should be able to get in most of these rooms and study these usable skeletons as well. Yeah, I'll put these bones, there's skulls over there right now, I'll put these bones there maybe later today. Again, sometimes I've got them in my office because I'm getting ready to use them in class, but often they're there. Yeah, good question. And that's really good to study from too, is using those real bones.
And like the packaging, it says inferior articular faucet. Is that the same thing as the process?
Yes.
Okay.
And some of these, and if you take a look at them, process is a projecting piece. Some of them actually have an obvious projecting piece. Some of them you just see a smooth surface where they fit one to another.
Okay.
Yeah, the facet and the process are the same thing. Our next major goal for the vertebrae is to be able to recognize different vertebral regions. So this is an overview of these 5 major vertebral regions. We start out with cervical on the top, that is neck vertebrae, then thoracic, then lumbar, then the very specialized sacral vertebra, as the sacrum, and then finally what we have are tail vertebra, caudal vertebra, more about that story in a minute, which is the coccyx a little bit further down here. We're going to go through each of these, and you're going to need to be able to identify these different vertebral regions, either from a whole skeleton or from individual bones. You should also know the numbering plan. And notice that all of these are numbered top to bottom, or superior to inferior. So if we look at thoracic vertebra, there are 12 thoracic vertebrae, and they start out numbered as 1. T1 would be the topmost one, then T2, then T3, then T4, T5, and so on, all the way down. Likewise, there are 7 cervical vertebrae, at least usually anyway. C1, C2, C3, they're always numbered from top to bottom. Ribs are numbered the same way from top to bottom. You will not have to distinguish between different individual vertebrae within a region. That is, you should be able to recognize cervical versus thoracic versus lumbar, but you don't have to distinguish between T6 and T7, or T7 and T8. Certainly in a more advanced class, more advanced application, you'd have to do that, but not here. Okay, let's start and look at how to tell these different kinds of vertebrae apart. And we're going to start out with cervical vertebra. How to tell cervical vertebra apart. Okay, we got some bones here just for a minute. That one's good. Cervical vertebra. Cervical vertebra are fairly easy to tell apart, identify, because they have these holes off to the side of the body. No other vertebra have them. Pretty easy to tell. They're called transverse foramina. That word's not in your list, so I'm not going to ask you what a transverse foramen is. But those holes, those transverse foramina, are distinctive. And otherwise, they vary a lot. The spinous process can be split, it can be single. But maybe you can see the little holes here. If not, I'll pass around a couple either direction. These are cervical vertebrae. These are what we call typical cervical vertebrae. There you go. C3 through C7 look like this. There are 2 very specialized cervical vertebrae that you need to be able to recognize as distinctive ones. They have important functional aspects about them. C1 and C2. C1 is the atlas. C2 is the axis. how to tell these apart. The Atlas C1 looks like a big ring. It actually has no body, no centrum associated with it. It's a big ring. So just a big ring-like structure with no centrum, no body. Very distinctive. This is the one that sits right underneath the skull. The skull sits right on top of it, and the skull rocks back and forth this way. The articulation between the atlas and the skull allows for nodding your head yes, for example. This is one of the few places where you've got a lot of mobility in the vertebral column, is right at the atlas axis joint. The axis, which is shown here and here, this is a top view and this is a side view, is identified by having this large point right here. In fact, developmentally, that's what happened to the body of the atlas. It actually sort of broke off and refused with here. It's something that's called the dens. Dens is that point. I'm not sure if that's on your list or not. If it is, I guess you're responsible to know it. If not, don't worry about the name specifically. The dens is that point. Let me find it. Let's see if I've got a couple of these and I'll pass them around. I may just have one or two of them. Maybe you can see this little point right here that we have. You can kind of see that dens point. That's very distinctive. I'll pass these around in a minute. And that allows them, okay, they're going to sit just like this. So on a person's neck, they're going to sit just like this. And what we have here basically allows for rotation right around that little cylinder. So allows for a twisting of the neck. So the atlas axis joint allows you to shake your head no. The atlas skull joint allows for shaking your head or nodding yes. The atlas axis joint allows for extreme rotation as in nodding no. And I'll pass, let's see if I've got another atlas. I may just have one atlas in my bunch. This is not a complete set, it's a mix of different individuals, and it's incomplete in it. Okay. I've got only one atlas, so I'll pass it around with an axis one direction. The other direction, all I've got is an axis, so I'll pass it around. You can see the axis. The atlas will take a while to get all the way around. Looks like we got our first clicker question of the day. I don't have quite as many clicker questions today. I will have a few here and there. Let's see if you can remember something we talked about probably a couple of lectures ago, probably almost a whole week ago. Or maybe you might be able to infer this just by thinking through it. You might remember it. You might be able to infer what it might be. So this asks, the atlas articulates, that is, connects with what skull structure? So there's a particular skull structure or structures on the skull that the atlas connects with. You might think of Atlas. Atlas was a member of the Greek god mythology that bore the world on his shoulders. You know, the idea here is Atlas supported the whole world. And again, the idea of Atlas here supports the cranium, supports the skull, the head. That's where that name came from. Well, let's see here. You got Atlas articulates with what skull structure? Condylar process, mastoid, occipital condyle, styloid process, zygomatic arch. You guys picked on this one now. You picked a lot of C. About half of you picked C. C is correct. Remember occipital condyles, I forgot to bring the skull in with me. Those were those two bumps on the bottom of the skull, and they fit in with those facets on that atlas, and that allows for the rocking of the head back and forth. So remember, condyles are rounded bumps that articulate with another bone. So at least if you picked a condyle name, you're thinking about what might have happened. So if you picked A or C, those are both reasonable choices, although C is the correct choice here. Oops, let's see, I need to get that one off. Let's go to thoracic vertebra next. Thoracic and lumbar are very similar, and so I'm going to demonstrate those together. Two thoracics and two lumbars. Thoracic vertebrae, there are 12 of them. They're below the cervical vertebra. Characteristics which they have. If you look at the body here, try not to get my fingers in the way too much. If we look at the body compared to the vertebral canal, vertebral frame, and they're about the same size. Notice the lack of the holes off to the side. They're not cervicals at all. Let's compare them with lumbar. And I'm picking some extreme ones here. Got two lumbars on the side there. Look at the lumbar vertebrae. They're much larger. The body is much larger. The vertebral canal tends to be smaller. It tends to be more triangular. Looks like I need to erase some things on the board. So what we have comparison here, these two very similar ones. And again, for lumbar vertebra, the body is way, way larger than the vertebral canal. That's a lumbar vertebra here. In cervical vertebra, the vertebral canal is, vertebral frame is only scarcely smaller than the vertebral body. And that kind of makes sense. Lumbar further down, they're supporting more weight. They can be more massive to support that heavier weight. Transverse processes. In thoracic, they are very rounded and they kind of project upward, almost nodule-like. In lumbar vertebrae, they project straight out to the side and they're thin, blade-like, or pointed. Here's a lumbar vertebra up against my dark shirt. I intentionally wore a dark shirt today for this. We have very thin, blade-like ones sticking out the side. In thoracic vertebra, what we have are very rounded knobs, and they kind of project upwards. See, there's very different anatomies with these. I'll pass around each direction a thoracic vertebra and a lumbar vertebra. On a test or quiz, I will give you typical looking ones. As you go further down in the spine, the lower thoracic vertebrae tend to be a little bit more transitional. I am not going to give you one of these transitional vertebrae. They're not too difficult to tell apart, but we're not trying to overload you here. At this level, what we're doing is will work just fine. We will give you typical looking thoracic and lumbar vertebrae. The lower ones start to look a little funny. They can usually be told apart just by those methods I told you, but they're a little more trickier that way. Another thing that one could use to identify, oops, we got a clicker question first here. Forgot about that. Let's see about our clicker question. You guys remember what I just told you. So this is seeing if you were paying attention. You took good notes just a few minutes ago. And I need this thing up here in just a minute. Pull it on over to. Whoa. Okay. Not quite yet. So we're looking there. The arrows point to the same thing. They are just one of them in a top view versus a side view. So kind of this area here or this area here, this bluish area right there. What is the function of that? You guys chose on this now. Looks like connect to other vertebrae and muscle attachment. Letter A is the correct choice. Very good on that one. Okay, you're paying attention. Those are the articular processes. If you don't remember the articular processes, they are right there. That's what they got muscle attachment. That's for the other things. That's for the spinous process, and that's for the transverse processes. But those articular processes allow vertebrae to connect one another. They prevent the twisting. Remember the clicking noises I did with the vertebrae just a few minutes ago. Okay, now back to another way in which we can identify thoracic vertebrae. This is not a clicker question. Let's just see if you can figure out what this might be here. Thoracic vertebrae have something attached to them. So if you're looking at a whole skeleton, there's another clue that helps out. Ribs. It's ribs. You have 12 pairs of ribs. You have 12 pairs of thoracic vertebrae. And so if you've got a whole skeleton, if it's got a rib attached to it, doesn't matter what kind of rib, any of these vertebrae with a rib attached to them are thoracic vertebrae. Normal, typical human, ribs only attached to thoracic vertebrae. Never rib cervical, never rib lumbar. However, I should point out, one of the things that you guys see in your text is just basically the most common variation that humans have. We show you these pictures like this is the way it's supposed to be. Excuse me. Dry throat there. But really there's a lot of variation that occurs there. And yes, people sometimes do have ribs in their cervical area. Not very often. It's usually a developmental gene malfunction. Usually not pathological, but sometimes it's associated with pathologies. Even these numbers vary a little bit. My mother learned she has 4 lumbar vertebrae instead of 5 lumbar vertebrae. Is that a pathology? No, it's just the development happens. And so that's one of the sad things about sometimes a textbook is you see one variation, and you think of anything different from that as somehow being abnormal, but often there's a lot of variation that exists. So what I'm giving you is maybe a typical scenario, typical human, but realize variations can exist. Okay, moving on. Lumbar vertebra, like I said, there's 5 lumbar vertebrae. We already mentioned characteristics about these. They have the relatively large body compared to the vertebral canal or vertebral foramen, which is actually usually triangular. And also these long, thin, slender transverse processes are particularly characteristic with them. They're particularly useful for identifying those particular vertebrae. The last 2 vertebral regions are easy to identify. These include sacrum. Sacral vertebrae are basically 5 that are fused together in a single bone called the sacrum. So the sacrum represents 5 fused sacral vertebrae. And this is where the hip bone's attached to. You see some rough surfaces on the edge where the pelvic bones, the hip bone's attached to. They're solid because they brace the large amount of weight needed to support through the lower limbs. We bear a lot of weight through we're bipedal through the legs, so those are nice and solid. Fusion represents or allows for structural strength. Coccyx are basically the remnant of our tail vertebrae. Yes, we had tails when we were embryos at one time. Very rarely humans are born with tails. Not very often, but that does happen a little bit. Normally these regress and are held inside the body. And we call that the coccyx, or maybe you've heard of the tailbone. You really do have a tailbone. It is actually a tail that you had one time in life. And I have very few of these because they're extraordinarily brittle. This is my only one. I think this is the only one we have anywhere in the department of a real tailbone coccyx. And I'll pass these around, but I've got 2 sacrum and the 1 coccyx. The coccyx is the tailbone. It's usually 3 or 4 fused vertebrae. They tend not to fuse till later in life, often well in the 30s or 40s or even later. So they tend to be a bit brittle, and yes, when you fall down and break your tailbone, you can break the coccyx or the separation between the 2 of them. There are some muscles that attach to them, but otherwise, they certainly don't function as a tail in mature humans, obviously. That area where they actually have a tail younger closes over normally with flesh and tissue. Questions or comments? Okay. Now we're going to move on to the last parts of the axial skeleton, sternum and ribs. We'll do the sternum first. Sternum is the breastbone. It's the bone right in front of the chest to which the ribs attach to. And it has 3 parts that you need to know. Okay, so it's going to look something like this. Three more or less parts to it. The middle part, where most of the ribs attach to, is called the body. The lower point is a xiphoid process. Sometimes this doesn't ossify until very well late, or especially ossify to the body. It can be a bit fragile. One has to be careful in a certain life-saving procedure not to break that off and send it like a spear down the liver. What life-saving procedure you need to be careful not to break off the xiphoid process?
CPR.
CPR, yes. You get down a little bit too low, a little bit too hard compressions, that can be broken off and actually sent down. That's a bad problem when that happens. The top of this is called the manubrium. sound in there. Manubrium means handle. And maybe I think people think maybe coming down from the handle or from the top it looks like a handle. Kind of I see that, kind of not. I don't have a human sternum to pass around, but that's a fairly straightforward bone.
Is that the only 3 parts you need?
That's it, yes. I think that's all on your list, isn't it?
Yeah.
Okay, good. If I miss something, let me know. So I can miss something.
So this Wednesday, are we covering, is
All
it
the way
mostly-
from the skull, all the way through the vertebrae, ribs, and sternum. So it covers a pretty big chunk.
all the way from there to today and all that?
Yes, I
Okay.
want you guys to be fairly caught up with the axial skeleton before we go into the appendicular, especially later in the week. Because the appendicular bones, there's quite a few things to know on the appendicular bones. If you try to learn them at the last minute, it can be a little bit hard.
Okay.
Generally, students have done worse on the appendicular questions when it comes to the exam than with the axial skeleton ones. I think they're trying to learn a lot of it right at the very end, and we're going to try to make sure you get the axial down, and that way you've got plenty of time to work on the appendicular at the end. Let's draw a rib. And again, I can just point out a picture of a rib, but the whole point is you guys can draw a rib as well. So it's a big curved kind of C-shaped structure. Some parts of this that you would have to know. There is a head, which is a bump on the end of the rib. So we've got a rib, and we're going to orient it something like this. Here's our rib. There is a bump a little bit back on it called the tubercle, or you may have learned it tuberculum, perhaps if you had a high school anatomy class, like the head also can be called capitulum. So there is a bump back here called the tubercle. This part is not present still in the rib, or you see just a little bit of it broken off. This is the cartilaginous, it's hyaline cartilage, portion of a rib, cartilage, which we see on our skeleton as the clearish parts right here. The very front of this is hyaline cartilage. It's a bit softer. It allows a little bit of mobility associated with the rib cage. This is where the vertebra attaches to. What kind of vertebra would that be, by the way? Thoracic. Remember, thoracic does that. And so when we have these that connect, let's see here. We can try to hold this more or less. I think I've got a left-right a rib I'm putting in the right position. I'm trying to match up what's on the board here. But at any rate, what you have is a rib where the head and the tubercle match up with the thoracic vertebra, and then the costal cartilage matches up with the sternum here in front. Ribs are numbered 1 through 12 again, starting with 1 at the top. The very bottom pair of ribs are called floating ribs because they don't connect to the sternum at all. They are ribs, they just don't connect to the sternum. There's a little bit of cartilage on the end of them, but not very much.
They call them false ribs, don't they?
False ribs are the group right up here. And that was one. There's true ribs which connect directly to the sternum without joining other ribs first. These down here, 6 through 10, are called false ribs. And you notice they all join together. 6 to 10 all join commonly before they connect to the sternum. Now, I don't think I put true and false ribs on your list, so I'm not going to ask you that. But you'd have true ribs, false ribs, and then floating ribs. Questions about ribs?
What numbers are the?
What's your favorite flavor?
Numbers 11 and 12. So the bottom two. Pairs 11 and 12. So we all have 12 thoracic vertebrae, 12 pairs of ribs.
What were you saying about 11 and 12?
11 and 12 are the floating ribs.
Oh, okay.
These are the bottom pair here, the bottom 2 pairs that do not connect to the sternum at all. There's no direct connection. Or if we look on our skeleton right here, we'll turn around so you can see. Here's number 11 right here. Here's number 12 right down here, not directly connected. Call those floating ribs.
And the rest are connected by the cartilage?
Yes, either directly to the sternum or maybe they join together before the sternum, but they get to the sternum one way or the other. Yeah.
Gotcha.
This just shows this connection here between the head and the tubercle, the ribs on the thoracic vertebra, allows a little bit of movement. The ribs are not fixed in position. That is a movable joint. It's a slightly movable joint. You saw the blue articular cartilage there, so it's slightly movable. This shows a little bit of this movability right here. So again, you see a little bit of the ribs, they can flex upward and outward, and that's permitted both by the costal cartilage down here, flexibility, and by the movable joints right up here. Oops. What's this thing right here, by the way? That's the sternum. Yeah, there's the sternum right there. Okay, try and get yourself. Last slide, then we're going to move on to appendicular skeleton after this. Shows what happens when a person gets what's called a slip disc, another major source of back pain, bad back pain if this happens. It obviously involves the intervertebral disc, but no, the disc does not actually slip off its location. That's sort of a misnomer there. The other name for this is herniated disc, which maybe more correctly explains it. What happens is you get a bit of the vertebral disc that pushes out. It develops a herniation, kind of an eruption, kind of a pushing out. The center is more softer than this outer area is. But for one reason or the other, it can develop this sort of protruding area, and that can push against the spinal cord or against the spinal nerve or both. And when that happens, you can have pain, you can have sensory dysfunction, numbness, muscle dysfunction, weakness, paralysis, depending on the severity and depending on the location. Sometimes that's corrected by surgery, but apparently about 60, 70, 80% of them repair themselves on their own, but they take a while, usually 6 months or more to repair themselves on their own. And often the surgeries have a fairly low success rate as it is. So a lot of times the simple course of action is just to kind of wait and see what happens on those.
So is it like fibers that actually protrude, or?
Well, there's the outer part is very fibrous. The inner part is kind of soft, but you develop kind of a gap, an opening in the fibers there that allows something to push through. So kind of like when someone get an abdominal hernia, which can occur in a lot of different areas. But if you get a weak spot in the abdominal wall where the peritoneum pushes through, you get a herniation there as well.
Okay.
For those of you zoology oriented, this is an old remnant of something called a notochord early in life. It's sort of pulpy inner area, and it's a little bit softer. It doesn't have as much fibrous tissue. Okay, that finishes up this one. Any more questions about axial skeleton? Again, this ends the material for fair game on the quiz on Wednesday. Yes, Reno. Question?
Can you go over the dens?
Yeah, dens, I don't have one here. That is that point on the axis. And that's the identifying feature of the axis. There's a little point on the body that projects up. And that is the dens. And that's what makes that one particularly distinctive. Okay, we've always got our movie quiz question to break up the flow just a little bit. And again, I'm always picking 1980s movies on this one. And anybody reckon, actually a pretty good one, pretty funny one. Very young Tom Hanks in this one, not his first movie.
I can't remember his name, but there's that family of cannibals next door, and he finds the femur. I cannot think of the name.
That's exactly it. Has Princess Leia on there, Carrie Fisher's his wife, and
I thought you would keep the femur.
yeah, he's got a femur on this one. That's the whole story here. We're going to learn out, which is pretty impressive, actually. Just the average person knew it was a human femur. And yeah, Burbs, the Burbs, have you ever heard of that before? Pretty funny comedy. Okay, moving on from that, it has a bunch of bones in it. We're going on to appendicular skeleton. We've already done axial, which is in blue. Appendicular here in more of the tan or natural look to them. Bones of the appendages, and also of those bones that connect the appendages, that is the shoulders and hip bones, to the main part of the skeleton. We're going to start out up here at the shoulder region. We call these shoulder bones, another term for these bones, we call this the pectoral girdle. The pectoral girdle are the shoulder bones. The scapula, shoulder blade, and the clavicles, collarbones. And these function to basically connect or anchor our upper limb onto the axial skeleton. So pectoral girdle consists of these two bones. These are basically collectively the shoulder bones. They connect the arm, the upper appendage, to the main part of the skeleton. And first thing we're going to do is clavicle. Clavicle is straightforward. No particular structures on clavicle to know, just be able to identify the bone. If you saw this isolated, how would you identify this? It is S-shaped. It's got double bends on it. There are no other bones that are S-shaped that have double bends. You might confuse that with a rib, but a rib is rather C-shaped. There's only one bend arch associated with it. All the other bones are straight, that are kind of long, skinny bones. I'll pass around these two. Again, there's a rib. Each way will have a rib and a clavicle, so you can compare them. They're real. They're brittle, by the way. The clavicles are particularly brittle. I have very few in the collection, probably because they break fairly easily. Clavicles are the only long bones that ossify by that intramembranous method. Every other long bone, pretty much from the neck down, every other bone, with some very rare exceptions, is endochondral. Being intramembranous bone, they ossify slowly. Person's clavicle does not ossify fully at least until they're in their 30s. It takes a long time for that to really ossify. It's slow to actually develop and fully get its bone mass. For that reason, clavicle is generally considered the most commonly broken bone in the body. I don't know what it takes. It varies depending upon the person's bone, but it probably takes more than that. But it's not a whole lot.
Broke mine once.
How old were you?
14.
That sounds about right, yes. When a person's younger and you fall and you catch yourself, you slip on the ice or you catch yourself, generally the weakest point between your hand all the way up here is the collarbone, is the clavicle, at least early in life. So generally young people, their teens, their 20s, even their 30s, they fall and they get a break resulting from trying to catch themselves. It's almost always the clavicle. Not always, but usually. But how about elderly people? My grandmother, she fell when she was probably in her 50s or 60s, and she broke, like typical elderly people, I can't remember if it was ulnar radius or both, she broke an arm or broke a bone down here. By the time you're older, this bone is pretty heavily ossified, and then usually weakest bones tend to be in the wrist area, ulnar radius right in here, and so it shifts a little bit. But early in life, clavicle is extremely commonly broken bone. Scapula is our next bone, and the scapulas I have are kind of mediocre quality. I'll do the best I can with them. This one's got some holes which are not natural. That's just a breakage, a loss of bone there. But anyway, clavicles are what we might call the shoulder blade bone. This should be an easy one to recognize. Big flat bone, shoulder blade bone should be pretty easy to recognize. Structures to know on our clavicle. Okay, this is going to be our right one. So we're going to first take a look at subscapular fossa. This one's colored in to show muscle attachment areas. This one's going to sit just like this in me. It's a right one. The subscapular fossa is on the underside of the bone. So if I flip this out, this big undersurface here, the whole thing is the subscapular fossa. Sub meaning underneath the scapula. Technically that's the anterior side because when it sits like this, that's anterior. So that's why it says this is anterior view. This whole under cavity surface is the subscapular fossa. There's a big muscle that sits in there, and we'll learn about that muscle later.
Looks like a steak.
Looks like a steak, yeah.
The ones you see in cartoons.
You're just going to make me hungry, aren't you?
I'm already there.
Okay. The rest of the scapula, structures that you have to know, and there are several features on this one. It's best first to get yourself oriented by finding the spine. The spine is this long ridge. In fact, that's what spine typically means, is long ridge. So we have this long ridge here is the spine. That's the spine of our scapula. If we follow the spine out to its point right here, we come to a structure called the acromion. So the acromion is the point of the spine. You can see I've got spine and acromion right here. So this is the spine. This is the acromion. It's kind of the high end point of the spine. Acropulo, acromi, acromo means a high place or set on a high location. Remember the Greek temple, the Acropolis? There was a famous Greek temple called the Acropolis, and it was set on a high hill. Somebody tell me, was that Athens? Ancient Athens? I'm embarrassed, I don't know my geography enough here. But yeah, I think that was Athens anyway, ancient Athens. I'll have to look that up where it's at. The Acropolis was a famous temple set on a high hill. Acropole for high, and here acromio, a high place. That's the high point of the end of the spine here. The spine is an important landmark because it identifies two more fossa, two more shallow depressions. There's one above the spine and one below the spine. And they have the appropriately described names: supraspinous fossa, above the spine; infraspinous fossa, below the spine. So what we see here is a supraspinous fossa above the spine. Supra means above, higher than. Infraspinous fossa down here, below the spine. Infra meaning below, underneath. Names are fairly descriptive, that makes sense. And all those are places where muscles attach. If you learn these bone structures right here, it's going to make the muscles a piece of cake later. You don't have to know these muscle names now, but they're all named where they're located at. There is a muscle called the subscapularis that occupies the subscapular fossa. For the supraspinous fossa, the muscle supraspinatus. For the muscle down here, the infraspinous fossa is the infraspinatus. So if you learn all these now, the muscles are going to be a piece of cake later on. And that's why we're learning some of these bone structures, as they'll be referred to later on. Questions so far? So we've got those two. Last two things on the scapula that you need to know. This other projecting point is called the coracoid process. So there's got the acromion, and then this coracoid process is the other projecting point. Again, it's kind of a lateral projecting point. I don't have much to help on this one. Coraco means crow, as in the bill of a crow or a raven. Maybe I see that. Maybe. I don't know. But that's what it means anyway. And then finally, there's this glenoid cavity. Glenoid, what do we call it here? Glenoid cavity, glenoid surface. It's kind of a smooth concavity right in here. The hole's drilled in. That's not natural. But that is the glenoid cavity. We can see it. Nice bit of bluish-white articular cartilage right there. And that brings us up to our next clicker question. And obviously, with that articular cartilage, that's going to form a joint. A joint where there is some mobility located with it. What do you think fits in there? I don't expect everybody to get this one. You might know this one. You might be able to get this one. Something is going to fit in there. Okay, you guys picked on this. Picked a lot of C was the most frequent answer. C is correct. That is the arm bone, the humerus. You might know the humerus already. I didn't expect everybody to get that. That's where the humerus is going to fit into. So we've got actually a. Let's do this. This will work better because this is a left and a left. So what we have is, here's the humerus. There's the nice round head of the humerus, and it fits right in that concavity. It's a fairly shallow one, pretty unstable, allows a lot of mobility. You can move your arm all around, but it's unstable, easily dislocated. Talk more about that when we get to hips later on as well.
I have that done too.
Questions? The way we're going to progress from here is we're going to go down the upper appendage. This is just our organizational slide. We're going to start with the single arm bone, the humerus, and then do forearm bones, wrist bones, hand bones, and finger bones. So we'll see all this again here in just a minute. Let's start with the arm bone, the humerus. We're starting proximal and gradually working our way distal. Humerus. This is the bone that is the most complicated of all the bones as far as the structures that you have to know. Has the most structures that you have to know. And I've grouped these as a top set of proximal structures versus a lower set of distal structures. That is, the top set are up here. Okay, this is the left. So these are up in the proximal, forming the shoulder joint. The bottom set here are going to be associated with the elbow joint right down in here. Well, the first thing to know associated with the humerus is getting yourself oriented. And yes, I may show on a picture on a quiz or a test an individual humerus bone. You need to recognize it's a humerus bone and get oriented. In fact, many of the structures are much easier to see if I show it simply as a loose individual bone than rather as one put together. You don't have the other things that are in the way so much. Humerus bone is a straight bone with this rounded area, the head on one end. Looks like and that's what the name of it is. It's just the head. Looks like the top of a cranium, the top of a skull here. That's on one end. Find that nice, smooth, rounded area. That's the head. Once you've done that, you can get yourself oriented. So no matter what direction this thing is laying, the head. The head always is on the proximal end and points medially, points in. If you can't remember that, just think about the way it has to work. You can't make the arm work unless it's oriented that way. So for the humerus, the humerus head is proximal and medial. That will get yourself oriented, whether it's left or right, whether it's whatever orientation that you see. And that's going to get ourselves oriented. Now we can look at some other structures that you have to know. We've already learned about this idea that tubercles are bumps. And there's a couple of bumps up here. Okay, there's a large bump and there's a smaller bump. And as you might guess, the larger bump is the greater tubercle. It's a little more lateral in position. Sometimes you can, if you've doesn't have a huge amount of muscles, like me, not heavily muscled, you can kind of feel the bump on the edge of your shoulder. You may be able to feel that greater tubercle. The lesser one is the lesser tubercle is the smaller, obviously, and it points forward. It points anteriorly. So it's going to sit just like this. If I don't get this one passed around today, I'll pass it around next time. I'm not sure if I'll get it passed around right now, but I will pass this around at some point. You can see it much easier close up. It's very obvious. You can see here on the outer edge, greater tubercle on the outer edge, lesser tubercle right in here. We have two necks on your list that you have to know, the anatomical neck and the surgical neck. Necks are constrictions. There's a constriction between your head and your shoulders. That's your neck. The anatomical neck is this constriction between the head and the tubercles. We can see this by this dotted black line here showing this constriction. That is, again, between the head and the tubercles. There's a little constriction. That's the anatomical neck. We call it because that's the old epiphyseal line. Remember where we had the primary and secondary ossifications and then they joined together at the epiphyseal line, the growth plate? That's where that represents, literally how it develops. Surgical neck is this constriction here, below this entire proximal end. So when it constricts right here, that's the surgical neck. And it's a place named because where you might need a lot of surgeries from. The reason why you might need a lot of surgeries is because this is the most frequent place of
dislocation?
Close. I mean, the whole thing dislocates. Or you need surgery right here. Most frequent? Break, yes. That's the most frequent fracture area on a humerus.
Oh, humerus.
So on a humerus, it's the most sorry, I didn't maybe clarify my thing on that. That's the most frequent fracture spot, breakage spot on a humerus is right here, why it's called the surgical neck. It's not the only place, and I've got a rather hideous picture to show you later of one of my students where they broke it in some other place.
Ew.
But that's this one.
Where is the anatomical neck?
Anatomical neck is right up here, and it's between the head and the tubercles. Head and the tubercles.
I once dislocated that too.
Frequent. We'll talk about that later. On the distal end, you have a couple of bumps down here on either side, and they're called epicondyles. So we look at the bumps here and here on the distal end. We'll do the epicondyles actually first because they're pretty easy. That's bumps on the side. We call them epicondyles because these do not connect with the forearm bones. They're simply bumps a little higher than the true condyles, which are down here, epi on top of. They're above the actual true condyles down here. They just serve as muscle attachment points. How to know which one's lateral and which one's medial? Well, the one that's medial is the one the same size as the head of the humerus, because you know that already. Or the medial's a bit more prominent. If you feel the bony bump on the inside of your elbow, that's the medial epicondyle. The lateral is not quite as obvious, although if you're skinny enough, you may be able to feel it. But the medial one is very prominent. We're going to stop there and learn about the true condyles then next time.